When the nerves come out of the intervertebral foramen, they branch to the primary ventral branch and the primary dorsal branch. The primary dorsal branch in the head and the neck, they'll go and innervate the muscles of the neck, the suboccipital nerve. Some of them are sensory, like the lesser auricular nerve, I believe. So this procedure here is going to show how we're going to stretch the posterior divisions. The last film was talking about trigeminal nerve 5, the spinal nuclear center. And this technique particularly stretches muscles in the suboccipital area there, which are closely associated with that CN5, cranial nerve 5. This is similar to another procedure you've seen when we did this lateral stenosis in the neck. And we can, the laterals, like I said, sometimes there's overlap with these procedures. It's just not one structure that's involved. The difference with this procedure than the last one is we keep the skull flexed. So I'm keeping your chin in, and I'm driving up. I'm driving your head up this. And you can imagine the stretch in the suboccipitals. Pressure on, pressure off, pressure on, pressure off. Feel the stretch in there? Mm-hmm. I could change the amount of flexion with that, the amount of rotation, the amount of side flexion, and the amount of this kind of. I can even rotate her the other way. So I'm working different muscles in the neck and suboccipitally. Stretching different nerves. Always getting the feedback from the patients. If I'm concerned a little bit lower down, upper thoracic, lower cervical pain, some people have this chronic pain in there, you can't get rid of that pain. It'll be similar to the procedure where we showed you the lateral stenosis, and it's like this. And I'm pulling up, and when they reproduce that pain in there, then we got it. I'm always aware of how the patient's responding during the procedure, though. Were you okay with that? Mm-hmm. So when we stretch the suboccipitals, as we're aware, the suboccipital nerve is motor to the suboccipital muscles, which are in very close relationship to the cranial nerves. But we're also doing the sensory nerves, the great occipital nerve and the third occipital nerve, which is sensory for the back of the head. So people with pains, occipital type pain, headaches or migraines, you might find some relief by getting blood into these nerves.